Thank you very much. Good morning, everyone. My name is Kristyn Wong-Tam, and I'm the MPP for Toronto Centre. I'm joined here today with a number of esteemed speakers, including clinical scientist and HPV researcher Dr. Gila Shapiro, Ryan Liss from the AIDS Committee of Toronto, as well as HPV Vaccine Coalition members, public and 2S LGBTQI health focused nurse practitioner Chris Dranos and Travis Frank Leneff, who is an outspoken advocate for free PrEP and PEP. My guests are at Queen's Park to support a motion I tabled last week in the House that can transform lives and save countless futures. Together, we call on the provincial government to take bold steps forward to strengthen our sexual health practices in Ontario by smartly investing in our healthcare system to significantly reduce sexually transmitted infections, STIs, and cancers. This isn't just a health initiative. It's an urgent call for action and compassion. My motion would have the HPV vaccine covered by OHIP at any age when recommended by a doctor. Ontario's healthcare system currently limits access to this life-saving vaccine despite its proven effectiveness. Cervical cancer, preventable through immunization and screening, is the fourth most common cancer in women globally and one of the fastest increasing cancers for females in Canada. The HPV vaccine prevents over 90% of cervical cancers caused by certain HPV strains. The HPV vaccine also protects against genital, rectal, and throat cancers. Investing in this vaccine now means saving lives. It means reducing expensive healthcare costs in the long run. My motion also calls on the government to provide take-home cervical cancer tests and extend OHIP coverage for pre- and post-exposure prophylaxis, PrEP and PEP, to stop HIV transmission. HPV self-screening tests are crucial. They provide a lifeline for those lacking access to a family doctor, those who live in remote, northern, or fly-in communities, those who live in neighborhoods who are underserved. These kits enable early detection and treatment, bridging healthcare access gaps and saving lives by catching cervical cancer in its most treatable stages. This empowers individuals, including those who are trans, non-binary, and trauma survivors, to take charge of their health, and it promotes better health outcomes and equity across the province. This government knows the research and understands that PrEP and PEP medication can stop HIV infections in its track. By providing OHIP coverage, Ontario can significantly reduce HIV transmissions in all our communities. Additionally, individuals using PrEP and PEP are often connected to regular STI testing, which helps reduce this and prevents the spread of other infections. This proactive approach protects individuals, promotes public health, and reduces long-term unsustainable healthcare costs. This motion is also very deeply personal for many in Ontario, including my own family. My wife was diagnosed with a very aggressive, rare form of cervical cancer last year. By pure luck, it was caught during a routine medical examination. Today, she is recovering because of the early detection of cancer. Whether a loved one lives or dies should not be left to chance. Everyone deserves the opportunity to be vaccinated, have access to take-home test kits, and like my wife, the medical intervention to catch this deadly disease early on so that they can have a healthy life. My son and I are glad she is here with us, and I want this for every family in Ontario. This government has the power to change the course of so many lives. By ensuring access to HPV vaccines, take-home cervical cancer test kits, and PrEP and PEP, we can safeguard the health of our communities and create a brighter and healthier future for all Ontarians. I would like now to welcome Dr. Gila Shapiro to take the podium. Thank you. Sorry, go ahead.
Good morning. My name is Gila Shapiro. I'm a clinician scientist and a researcher in Toronto, and I'm here on behalf of a very dedicated community group based in Ontario focused on the prevention of HPV. HPV, or human papillomavirus, can cause cancers including cervical, anal genital, and head and neck cancers. The HPV vaccine represents a unique opportunity to prevent HPV-associated cancers. Our community group involves leadership from Swan Public Affairs, Rhea Health, and individuals with lived experience in the matters of this motion. What they say, and what my research and clinical experience indicate, is that HPV vaccination needs to be more accessible, available, and affordable for everyone to be able to benefit from this underused cancer prevention tool in Ontario. In my opinion, this motion is straightforward, and I'm very proud to support it.
Thank you.
Hello, my name is Ryan Lisk. I'm with the AIDS Committee of Toronto, also known as ACT. On behalf of ACT, we enthusiastically support Motion 123. ACT has been around for over 40 years. Originally formed during the height of the AIDS crisis in the 80s, we have seen countless lives lost to HIV and AIDS. Over the past 4 decades, Ontario's most marginalized populations, including gay, bi, queer, and trans guys, as well as Black, Indigenous, and trans women of color, continue to be at risk for new HIV infections in Toronto and across the province. We now have biomedical options to prevent new HIV infections. HIV post-exposure prophylaxis, as known as PrEP, is a 28-day regimen of HIV medications taken 24 to 72 hours after an HIV exposure, including needle stick injuries, sexual assault, and condomless sex with someone of an unknown HIV status. HIV pre-exposure prophylaxis is a daily medication taken to prevent HIV-negative people from becoming HIV positive, and it is over 99% effective. HIV stigma and the cost of these highly effective medications continue to be our biggest barriers to preventing new HIV infections in Ontario. By investing in these HIV prevention strategies, we are reducing the healthcare demands and the OHIP strain of hundreds of thousands of dollars per person for treatment costs for the people living with HIV in this province. Motion 123 has the potential to eradicate new HIV infections in Ontario.
Thank you so much. Go ahead.
Hi, I'm Travis Franklin F., and I'm just here to share my own personal experience with how I contracted HIV when it was something that was preventable. Every barrier that's put in people's way prevents them from access. And if I had, been able to access this care and had less barriers in my way, I would not have HIV today. I wouldn't have to share that I have HIV with everyone. And there was promises made of an HIV-free generation, and it's possible. That's it, I guess. Thank you.
Thank you. That was wonderful. I'm happy to also recognize my colleague and friend, Jessica Bell, MPP from University Rosedale. We are welcoming all questions from media who are here today.
Me? Have you been talking with the Minister of Health about your motion?
Yeah, so the minister, as you know, the House rose quite early as of last week, but I have had conversations with the minister about the subject matter in various threads of conversations. And I have not received any indication from the minister that they are supportive, although I get acknowledgement that this is an important issue.
And you said the government knows the research, yet we're not acting on it. Why do you think is that?
It's a very good question. The effectiveness of PrEP and PEP is quite universally known now. The research is broad and conclusive and worldwide. Whether or not the government is willing to act on it, you'll have to ask the question of the minister. But I think it has something to do with the population that requires it, and it should be stated today and repeated that access to PrEP and PEP is not just to benefit the gay community. It is specifically helpful to communities who are sexually active. But I think we also know that this government will not oftentimes lead the charge on ensuring healthy practices, healthy sexual practices, especially for marginalized, vulnerable communities. I'm not sure if Ryan would like to speak to this, because I feel like as a representative of the AIDS Committee of Toronto, they've done a lot of research and they have had a lot of interface with other AIDS service organizations who are in direct conversation with the ministry.
Yeah, I think we've had many conversations over the last several years. We are funded as a nonprofit organization through the Ministry of Health. There is a commitment to doing this work. I can't speak directly to the minister's stance on this, but some efforts are there. We have the science, we have the evidence. We've been able to make referrals where possible to clinicians that are doing this work. But
and do you have like a dollar figure in terms of saving for the health system?
I can speak a little bit to the cost of medications for individuals, but I don't have a broader. I can get that information for you.
But just for someone like access to PrEP, for instance,
Yeah.
if it's not covered, how much would that?
Yeah, if someone didn't have coverage, it would be anywhere from $200 to $1,000 a month to get access to HIV PrEP medications, and similar costs around $1,000 to $1,500 if somebody needed access to PEP or post-exposure prophylaxis. So for an individual or a marginalized individual, someone who maybe is precariously employed or just doesn't have a benefits package, those are infeasible amounts of money that people can't afford, and it is life-changing for people.
And last question: any French speakers on the stage today, or no? No one? No. Okay, that's good. That's it.
Are there any questions online?
No.
Okay. Thank you very much, everyone, for attending our press conference. Thank you for tuning in. This concludes our press conference today.